Hello, Steve. Hello. Open your eyes for me, darling. You okay? Yeah, any sickness? No? It's fine.
The surgery itself is done through a relatively small incision on the inside of the leg, in this sort of area on the inner side. The operation takes about an hour. We put it down to a fine art these days, so it's not a very lengthy procedure. It can take longer or a bit shorter depending. When the patient wakes up, they'll have a large bandage on their leg. They're unlikely to have a drainage tube in, but some surgeons do use them. They'll have foot pumps on their feet, and that's to help prevent blood clots. And they'll wake up in recovery, be sent back to the ward, and on that first afternoon, we'll have a quiet time.
Everybody's different. Every procedure is different, so therefore we have to take each case on an individual basis. So if it's right to get up for the patient and for the procedure, we'd do that. If the patient has had an osteotomy, obviously it's a slightly bigger operation, so again they will be resting on the bed, usually overnight, and then if they feel well enough, we'll start off with some basic exercises to check they can move their knee safely, and if they feel well enough, again we're going to get up using crutches.
With the modern osteotomies and the plates that we fix them with, they're very robust, and we're actually happy for patients to weight bear from the off, much as they do with joint replacement. However, most patients are quite sore afterwards and don't fully weight bear for a few days or 2 or 3 weeks afterwards, so they're using crutches for some support.
Every operation is different, every patient's different, so we hope to be able to adapt and adjust according to our patient's needs.
After any kind of surgery, but particularly knee surgery, it's really important they get up and moving straight away. Often they'll be quite sore. Yes, it is sore, but you need to do it. You need to get up and get moving and do your exercises to get the flexibility back and start getting the strength and mobility back as quickly as you can.
Well, mobility is the most important thing, keeping the circulation going, keeping the joints going, keeping the muscles working. So we can start that these days from day one. You know, people aren't put in plaster anymore, they're not immobilised in bed for long periods of time. The surgery has progressed in such a way that we can get them up on day one and get them going, and it's hugely beneficial to the patient.
They'll see a physiotherapist the day after surgery, the morning after surgery. They will get them safely out of bed. They will assess the knee. They will start giving them some gentle exercises from day one. And by day 2 or 3, most of these patients are quite young, bear in mind, we'd expect you to be able to walk safely with your crutches up and down stairs and be dischargeable home.
Once the medical and physio team are happy that you can walk easily and are confident and comfortable going up and down stairs, you'll be allowed to go home. Usually that will be 2 to 3 days after your operation.